Hi, I'm Julia Clarke. I'm presenting on my master's research at the University of Ottawa, which looks at trans and gender nonconforming clients' experiences of therapy and of their gender identity as it relates to media that represents TGNC stories, narratives, histories, etc. So I'm going to look at the literature and rationale for the study, my research question, methodology, very brief look at results, and implications. So as most of us at this conference know, I would say mental health services for TGNC folks are generally lacking, often non-affirmative. They're often grouped in with the needs of queer clients, even though they have very different experiences and mental health needs. We also know that mental health professionals don't feel equipped to work with TGNC populations, and that client experiences can range from beneficial to actively harmful. On the media side of things, so media representations of TGNC people has increased since the 70s. It's gotten a little bit more empathetic and humanizing in recent years, but TGNC people are still rarely given authority over how they're represented, even though they experience the repercussions of that representation. Media can rely on stereotypes. It often caters to cis audiences, but it's also a huge source of resilience for TGNC individuals for establishing social connections, processing identity, learning about transition resources, and translating their experiences to loved ones who are learning about what that experience is like. Bringing those two areas of study together, my research question was, what are TGNC clients' experiences of therapy and of their gender identity as it relates to media that focuses on TGNC identities? This was a qualitative study using hermeneutic phenomenology, so looking at staying experience close, but bringing in the feminist standpoint theory to make sure that identity and political concerns are at the forefront as well. So just to look at results, I've just put in the 6 themes and sub-themes, but I had 4 participants, 3 of whom identified as non-binary, 1 identified as a trans woman. They were all either in Ontario or Atlantic Canada. They ranged in age from 18 to 35. 2 participants identified as white, 1 as South Asian, and 1 as Indigenous Latinx. First theme, media in the therapy room. So participants all had experiences with either them or their therapist bringing media into the therapy room, as well as experiencing barriers to bringing especially TGNC-focused media into therapy because of other non-affirming experiences, not feeling like it was a safe space to do so. The role of media outside of therapy for them, there was a sense that representation, especially in traditional media, so non-social media, had changed dramatically over the past number of years, but that there were still continued challenges in that representation. And the complexities of what we would think of as good or bad media, okay, what's a positive representation and what's not, how that's often a lot more complex for TGNC folks and how it informs their sense of their own gender or how they talk to others in their life about it. Third theme, how media comes into the world of mental health and identity, not necessarily as it relates to therapy, but, a lot of participants, the first time that they encountered someone who was gender diverse was in a piece of media, often use it to resource information and to form a sense of community, especially on social media. All had at some point experienced non-affirming therapy in varying degrees of intensity. There was an overall sense that mental health practitioners lack education to work with TGNC clients, that when that lack is there, the burden then moves to communities to fill in the gap where that professional care should be. Participants sometimes felt that they needed to keep their identity exploration distinct from therapy, and spoke about how media was sometimes a catalyst for moving identity explorations forward, whereas therapy could at times stunt that process or make them feel like it wasn't something that they should explore further. Theme number 5, so participants experience this inadequate care. What do they then do with that? Experiencing feelings of rejection and self-blame, having to have the skills to identify the quality of care that you've received to even know whether it's affirming or not. And then unfortunately over time learning to accept less because the standard has been so low. Okay, well my therapist isn't overtly transphobic, they're fairly affirming kind of thing. I also had a perception that things had changed and had hopes for the future. So that education was becoming more widespread, affirming care more widespread. They were able to advocate for more for themselves and saw ways that therapists could use media as a tool. Implications, very quickly, working with TGNC clients, welcoming gender into the therapy space, pretty basic, being client-led and how much gender factors into clinical work. If they're saying this is a part of my identity, but it's not relevant to what I want to talk about, going with that, or, bringing it in more when they want to bring it in more. Recognizing your privilege as a practitioner, wherever you are on the gender spectrum. Recognizing that clients may have past negative experiences with someone in your job or in a similar job. Trying to get some of that education and experience and being transparent about the education and experience that you do have. Working with media. Media can be a tool of education for the therapist. It can be used in a kind of symptom therapy approach where it's within the session. Using social media as a resource building tool. Recognizing the significance of media for clients and how that's often complex. And again, collaborating with them on how this whole process plays out. There's just some select references there and some contact information for me. And this study was funded by the Social Sciences and Humanities Research Council of Canada. Thank you.